Hello, thank you for joining us for this webinar on the topic of what ag producers need to know about COVID-19. AgriSafe is able to offer this webinar because of supporters like Gallagher. We look at emerging issues and oftentimes they happen so quickly, and without the support of companies, it's very difficult for us to pull the resources to make this happen in such a short period of time. So we are thankful for their support and glad that we're able to offer this webinar at no cost. If you're not familiar with AgriSafe, it'd be good for you to know that we are a national nonprofit. We work in a lot of different areas related to health disparities, and we believe that those who feed the world need protection. Emerging issues do come quickly, and of course, COVID-19 is one of them. Think about membership to AgriSafe. If you're not already a member, your support helps us continue to drive good public health information and create partnerships that make a long-lasting impact on a national scale. As far as today's webinar, if you're listening to it now, you're listening to the recording, but know that recording is available and will become part of our permanent library that you're able to access at a time that's right for you. So if you have colleagues that are interested in this training, feel free to let them know. They will need to open up a guest account to access this training. There is evaluation questions. Please take time to fill those out. And of course, there's a certificate that you can print out. It may be a good thing to have in-house and share with your employer. We're going to go ahead and move, just kind of let you know who our lineup is here in terms of our speakers. And we're very happy to say that we pulled together diverse experts in this field to really bring a well-rounded webinar. The first presenter that you'll hear from is Dr. Chad Roy. He is the Director of Infectious Disease Air Biology and Director of Biodefense Research Program at the Tulane National Primate Research Center. He's a Professor of Microbiology and Immunology at the Tulane School of Medicine. On board is also Dr. Heather Fowler. She's the Director of Producer and Public Health for the National Pork Board. Also speaking today is Dr. Jeff Bender. He's a professor and director of the Upper Midwest Agricultural Safety and Health Center, School of Public Health at the University of Minnesota. Also joining us is Mike Keenan, Risk Control Manager for Gallagher National Risk Control. And finally, our last speaker is Charlotte Halverson. She's an occupational health nurse and clinical director for the AgriSafe network. And the full bios of each of these presenters is available in the Learning Lab when you look under the speaker section if you want to learn more about their work. I'm going to go ahead and move to our first presenter, Dr. Chad Roy. So just give me a minute. I will go ahead and make him the presenter. Okay, there you go.
Hello?
I see your slide.
Hello,
There you go.
hello?
I see your slide.
Hello, can you hear me?
Yes, I can hear you and
Okay,
I can see
great.
your slide.
All right, wonderful. I'll just switch it into, okay, great. So thanks, Natalie. And what I want to do in the next 15 minutes or so is kind of go over the basis to hopefully give a baseline information on the how, what, where, and why this emerging virus has emerged. And so there's a couple of slides here that may be a little tricky scientifically, but it's to just give a base of why this emerged now and how it's moving through the human population and that kind of thing as a segue for some of the very important things that are going to be talked about in the subsequent panelists like Dr. Fowler and others on preventive measures and that sort of thing. But it's always good to know what we're dealing with at the most basic level. You guys may have heard a lot of this information and there's like one bit or another, but we'll go through it here fairly quickly. So the first slide, how it all started. So December 31st, me see if I can move this. Oh yeah, there you go. So how it all started on December 31st, several cases of pneumonia that were identified with an unknown etiology that were reported in Wuhan, a large city, about 5 times the size of London. That's how big Wuhan is. It's a very large city in Hubei province in central China. It was reported to the WHO and talked a lot about these cases emanating from a wet market where food is processed and bought, and you can see the picture there, to where slaughter is provided for live animal purchase in these wet markets and all the possible exposure pathways there. Whoop. Okay. It probably started earlier, however, so some of the early cases came from that seafood market exposure, but from some of the epidemiology retrospectively, it looks like there was cases outside of that wet market exposure, and you can see how quickly the case reports were relative to this viral emergence. It was identified as a coronavirus, as the etiological agent of disease, and that was done through some genetic analysis of some of the early patients here. And so this little communique was when it was finally identified as a coronavirus, as the virus causing the unknown pneumonias. So what is a coronavirus? Well, it's a family of viruses. So this is not the only one out there. Corona means crown, and that's kind of the morphologically what this viral particle looks like. It's a single-stranded positive sense RNA virus. Its genome is about 30 kb. That's really big for an RNA virus. It is an envelope virus, so it's got a coat around it, and it's about 120 nanometers in diameter. And why we bring that up is that this is remarkably small. Viruses are remarkably small in the environment. So a single aerosol drop, for instance, could have hundreds of viral particles encompassing that single drop. So it's unlike a bacteria, which can be a little larger in the world of microbiology, viruses are quite small. And so this one's about 120 nanometers. So good cocktail party conversation piece there. So what are coronaviruses? Well, coronaviruses now cause about 30% of all the common colds that we get. They're everywhere. They're not just here. We're just talking about this one now because it's in the news. It's caused this, pandemic disease. But both alpha coronaviruses and beta coronaviruses are around us at all times of different strains. The zoonotic coronaviruses, so ones that have emerged from animals and transferred to humans and have become a human pathogen, those are the beta coronaviruses. And we've had those in the past. So as many of you may remember, from 2003, we had SARS, the original SARS, that emerged in Asia, and that caused a epidemic disease in Hong Kong and Toronto. That was a much more virulent coronavirus compared to what we're dealing with now. And then in about, I think it was around 2008, MERS, or Middle Eastern Respiratory Syndrome coronavirus, emerged. That was from a source of, I think, from camels that emerged and showed up on the stage as a human pathogen, and which is still kind of smoldering in those areas, by the way. So MERS isn't completely gone from human disease. So not that anybody would want to remember this phylogenetic tree of where all those viruses show on the alpha and beta coronaviruses. This one fits nicely, the one that we're dealing with now, in the classification with SARS and with MERS, as you can see there. So this is genomically, it's not terribly different from those based on how it falls in this tree. And so we're calling the disease, so the International Commission that names these types of things, names viruses, the virus is SARS-CoV-2, so or HCOV-19. The disease that it causes is COVID-19, and that was designated by WHO, so coronavirus disease 2019. So we're using those interchangeably now when people talk about COVID-19 or SARS-CoV-2. One's a disease and the clinical manifestations of that viral infection, but the virus is actually referred to as SARS-CoV-2. So where did this come from? So we know that it emerged in Wuhan and the Hubei province in central China, but it's very improbable that this emerged, and many of you have probably heard that. The conspiracy theories that maybe it was created in a lab or something like that, highly, highly unlikely based on how this has emerged. And the reason that we say that is that this particular virus has been designated as a recombinant virus. So recombinant meaning that it's exchange genetic material with other viruses in the environment once it's in a different animal species. And aspects of that can also be human too. So it's a mishmash of different genetic material from a variety of different sources. And so that's why I refer to it as a recombinant virus. And some of the world's best virologists have shown that through analysis of the genome that's comprises this virus. So what made it emerge, however, and into a human pathogen is that it was naturally, through recombination, optimized for binding a particular receptor in the body of humans that we harbor, as well as other animals, by the way, that is unique. And so that's what makes it and why it's caused it to emerge as a human pathogen. So there's two ways that can do that: through natural selection before zoonotic transfer, or natural selection in a human following zoonotic transfer. So and this this slide kind of shows that and why we think that it's a recombinant product from that bottom zoonotic viral pools there, and recombination events that take place in nature. So this is something that naturally happened. It wasn't an artificial manipulation, and that would be possible reservoirs. You've heard, I'm sure, like bats. This is a great picture of a bat, and because of their biology, they can harbor these types of viruses, as well as the pangolin, which is otherwise known as Chinese anteater, and the possibility of it harboring in this animal in the environment. And this could be years and years and years, and I'm sure it was years and years before emergence took place and these processes started. So what do we know about the virus? And this is a great shot of a virus that's been pseudo-colored, so it can show up and it shows what these viral particles look like under electron microscopy, because they're quite small. So right now, in terms of kind of emergence, epidemiology, pathophysiology, it's been through a region of our world, and it had emerged, it peaked, and then it's now not disappeared, but it's tailed off in that region. So we have a picture of how this moves through human population. And that's very important because we can do a quick study to see what happened in that particular population, not necessarily the same as the United States in terms of how their social structures are and that kind of thing, but it gives us a good idea of the how this virus infected people, how it moved through versus, in transmission, horizontal transmission, meaning the infected individual to a naive individual, how that takes place, what's important in that process. And this shows an early chronology of those events. This slide is from the Chinese CDC on how they tracked it from the reporting of an unusual pneumonia cluster in that city all the way out to sequencing the virus and adding it to notifiable diseases in January 20th. You see there and how fast they worked with this virus. This is a shot of Hubei province, December 31st, and how it spread. And I'm sure many of you have seen different illustrations of how this spread, but it was pretty amazing how quickly this spread and transmitted to adjoining provinces in China, many of which are major metropolitan centers, including Wuhan, where it comes from. The clinical prognosis and recovery is unique for this virus in that there's not that many cases that culminate in a severe outcome like death, but it brings from the critical to the mild cases. There are a small component that will culminate in death, usually associated with comorbidities. The vast majority of people that are infected do recover, and that's shown here in this very interesting illustration. This shows the ramp up. If we look back, and this is just in January, this is just a couple of months ago, and again, this is slides from the Chinese CDC showing date of onset and identification of cases starting with January 1st, and the kind of original trajectory on the date of onset and the actual date of report that lags a bit, starting around the 21st of January. So this is in really real time. So this is number of confirmed cases by sampling. Demographically, how this breaks down in the population, it looks like younger demographic is not as affected as the older demographic, at least in the Chinese experience, with 90+% of cases affecting either young adults all the way up to older adults, and that it is not gender specific, that it looks like it's an equal spread between male and female gender. Common symptomology of this disease in the Chinese experience was by far a fever and dry cough that emerged for either mild, severe, or critical cases. Up to 80% in the proportion of cases experienced fever, dry cough with some of these other symptomologies like fatigue otherwise from there. So when there are comorbidities or when there is a severe case, how do people succumb to this? Well, it is associated with acute respiratory distress syndrome, and that's why we call it a pneumonia. The viral infection takes hold in the most susceptible part of the lung, so the terminal bronchioles and the alveolar space where oxygen transfer takes place. And because of the massive inflammation associated with the viral infection, it disrupts that process dramatically. And so, it disrupts that dramatically. And so that's mainly the reason or the cause of death in individuals where this manifests as a severe disease. So just very quickly, I want to run through some of the insights. Again, this is from the Chinese CDC on the Chinese outbreak and what we can learn from that. The majority of cases in terms of transmission were from close contacts with symptomatic cases, so not asymptomatic cases in that case. And 1 to 5% of those close contacts developed the disease COVID-19 in those 3 areas. The transmission was mainly family clusters. That the secondary household attack rates were about 10% early in the outbreak. but this fell with faster isolation. Transmission in closed setting was happening, but not a major driver in the Chinese experience. And then transmission in schools really wasn't observed, and they had a real strict lockdown policy that took place there. They're very authoritative, an authoritarian approach to it. That's not necessarily what we have here in the United States, and so I think they curbed it in that regard. In terms of the natural history of disease, so I mentioned this before, at diagnosis, about 80%, so the vast majority of cases were mild or moderate manifestations in humans, and only about 10% of those progressed to become severe. And the average time from exposure to symptom onset was 5 to 6 days, which is a little long for viral infections. With symptom onset and recovery from 2 weeks to 3 to 6 weeks in severe cases, and symptom onset to death in those very small fraction of cases was about 2 to 8 weeks, so a big span there. And so, and generally the children and the younger demographic is, and I'm sure all of you have heard this in the news, have milder disease than adults, and many times asymptomatic disease. Finally, in terms of the virology, we think that viral shedding is highest early in the course of disease. Now, I can update this with some information that's just coming out, that viral shedding can actually take place in asymptomatic individuals, as well as as well as in late stage disease or even convalescence. And this is emerging now from what we know that viral shedding can take place longer than most normal viral infections, and you can think of things like flu. And this kind of shows the differences between the SARS, MERS, and then our new emerging SARS-CoV-2 in terms of, and some of this is dated, but that in terms of our reservoir bats, so the pangolin, similar to the other coronavirus agents, attack rates, transmission that spans from oral fecal to droplet and aerosol infection, and that sort of thing. But our other panelists are going to talk about infection prevention, so we'll leave it to them. Finally, I'm going to leave off. This is a screenshot that I just grabbed. I'm sure some of you or many of you have looked at this great infographic, but I thought it was a great segue to our next panelist, showing as of this morning, the total confirmed cases are 354,000 worldwide, and the United States is getting redder and redder in that onset of disease on the North American continent. So I'll end there, and I guess we can go to the next panelist.
Great, thank you, Dr. Roy. I'm going to go ahead and transfer it to Dr. Fowler. She's our next presenter here.
Thank you so much. I want to go ahead, let's see, beginning, make sure that I am sharing the right screen so you guys can see the full screen and not the presenter mode,
Yep.
correct?
Perfect.
So I will talk more about the COVID experience in the United States. So as was mentioned, as shown on the website, and we talked very briefly in the beginning, I'm a public health veterinarian by training. I also have a PhD in worker safety and health from the Center for One Health Research in the University of Washington in Seattle. So I'm a true One Health champion, and this is definitely a One Health issue. So really interested and excited to present to you guys today. On this topic, I currently work as the Director, Producer, and Public Health at the National Pork Board. I've been in that position since 2017, so I oversee the research as it relates to public health topics very broadly, including worker safety and health, food safety, etc. So really been following this issue as it relates to our pork producers and what it means for them, especially from a continuity of business perspective and their workforce. So I've outlined the talk really to, again, cover COVID-19 in the US, go through some of the specifics, talk briefly about COVID-19 in animals as well as disease prevention. So as Dr. Roy mentioned, the picture is rapidly changing. Johns Hopkins has some great resources, but for my presentation, definitely want to drive you to some of those resources, and we'll make sure that the slides are available after the call, and these hyperlinks in this credit line at the bottom of each slide, you'll see really provide some information and references to everything I'm showing you today. So in the United States, you'll see some discrepancies in the number of cases. This number was pulled from the Centers for Disease Control and Prevention, but as we have more and more labs locally that are doing their own testing, we'll see some of those discrepancies. And the CDC says, you know, definitely trust your state or local health department to have that information. They do, however, continue to share updates as they know that they are a trusted resource of this information. They have this nice heat map on their website that shows the different states, different caseloads, but they also have it built in, they have a hyperlink, excuse me, built in so that you can click on your state and learn more about it. So I'm located here in New Jersey, and that would route me directly to my health department. So it's important to point out, however, as we talk about the number of cases, the majority of those are under investigation in terms of what categories do they fall into: community spread, travel associated contact, or close contact, and some of those are tests that are pending. Again, really want to make it clear to folks that are watching that the CDC has tons of guidance on their website for all different situations and issues that you may have. So if you can see here, they have travel guidance for at-risk populations, all the different areas. And again, this links you here. Ultimately, you can Google COVID-19 and CDC, and it'll take you to their landing page, which will allow you to kind of click through and get the information you need. So what you've been hearing a lot lately is this focus on at-risk or higher risk or vulnerable populations. Unlike most infectious diseases, when we think of the yoppies or the young, the old, the pregnant, the immunocompromised, what we've seen so far at least, and keep in mind, as Dr. Roy mentioned, a lot of what we know about COVID-19 comes from the data we got from China. They've had over 40,000 cases in a period of 2 months. This comes from a publication that was posted in February, or published in February, excuse me, that just shows the distribution of the ages of individuals and the proportion of folks that died as a result of their cases or their illness, excuse me. So the blue bars here represent the proportion that fell in a given age group, and the orange represent the proportion of folks that died as a result. So you can see as you get to that 60 plus range, you have really tall bars, the highest being in those over 80 years old. Additionally, in that publication, they looked at other underlying conditions that these cases had, especially the ones with severe disease and or that related in death, and noticed some secondary chronic conditions that these individuals had, suggesting an immunocompromised state. So again, as we continue to see more cases, we're in the tens of thousands right now in the United States, we'll continue to learn more about the virus in the US population and what it means. There's also been some talk of, just in terms of the proportion of cases in, say, the 20 to 30 range, we suspect that we might see some different distributions there. There's lately been a lot of conversations around mass gatherings, so just social events, places where lots of people come together. I mentioned that CDC has guidance on numerous topics that includes mass gatherings. Keep in mind that these are interim guidances on the different topics, so it really is a living document. And what you really see, and as it relates to those mass gatherings, if you were watching this a couple weeks ago, you could see this document change and evolve. And the CDC has done a great job of really highlighting what those changes are in that document as they make those updates. So initially, they really focused on preparedness for our organizers, how to plan for COVID-19, what things to put in place, hand washings, hand sanitizers, etc., what to do if you identify someone during the event, etc. They also then started to highlight those vulnerable populations as that data became available. And then just a week or so ago, they made the recommendation to reduce that number. So if you have it was initially 250, then it dropped down to 50 people or more. They said go ahead and cancel or postpone those events for at least 8 weeks. And the goal there is to flatten the curve, though we've heard more and more of, especially coming out of the White House, and I have links below again, trying to reduce that number even further to fewer people together gathering as possible. I provide a link here to the flattening the curve graphic. I think a lot of folks are familiar with it now. It shows essentially 2 different outbreak or epidemic curves. The first one is very tall, right? And there's this focus on that healthcare system capacity. So if it's too tall, excuse me, we will not be able to fully meet the needs of those individuals with severe disease, whether it's from a number of beds, hospital space, or ventilators issue or metric. We're really trying to make sure that we, by flattening this curve, that everyone gets the care that they need, especially those with severe diseases. If the scientific jargon doesn't meet your needs, there's been some fun memes that have gone around that use different terms that mean a little bit more than other folks, and I find this cat one both funny and accurate. Some of the questions I get from producers, especially as we're starting to see in response to this goal of flattening the curve and reducing those mass gatherings, a number of states, I'm going to say Illinois, California, New York, I live in New Jersey, we implemented a stay-at-home executive order, or excuse me, the governor implemented a stay-at-home executive order over the weekend. Ohio has one that'll go into effect probably by the end of the day today. And so there's been this comment around essential or non-essential businesses having to close, again, with that goal of flattening the curve. And so I do want to make it clear, the cybersecurity, information security, and excuse me, the CISA, I forget entirely what that stands for, but it's around cybersecurity and other information security infrastructure, provide some guidance on essential workers. And so there's a comment on that critical infrastructure. So I show this figure here to show you what those different areas are. So regardless if we're talking natural disaster or pandemic, we need to make sure that these places are still open and functioning to serve the needs of the American public. So food and agriculture is listed as one of those critical areas, and there's a specific call out to animal agriculture. What we are seeing is, some of the small animal veterinarians aren't specifically called out in these areas. Things like different areas might also be listed or can be listed, state-specific rules that are going out. So a quick comment about disinfectants as it relates to COVID-19, as I know this is a question I've gotten quite a lot. Are there any veterinary disinfectants that are effective against COVID-19? Well, that depends. EPA has a list of the effective disinfectants, and again, provide the links below. American Chemistry Council also has a list of disinfectants that are effective against COVID-19. But again, remember that we're talking about a human disease, and so we need to look at those disinfectants as a human coronavirus claim. What I can tell you, having looked at that list, the categories in terms of the broad categories that are different disinfectants, including veterinary disinfectants, fall into are some of the same ones that we use commonly in the veterinary community. In addition, the National Pork Board has funded research, in the past that looked specifically at swine coronaviruses. And to be completely clear, swine coronaviruses only affect pigs. And those are things like PEDV, TGEV, which are both alpha coronaviruses. And then as the name suggests with porcine delta coronavirus, that's a delta coronavirus. Again, those are viruses of swine. Do not confuse those with COVID-19 or SARS-CoV, which we are currently talking about with this outbreak. With that said, we have done work that suggests that there are disinfectants in the veterinary community that work for swine-specific ones. Not necessarily, I don't necessarily encourage you to assume that they would work, but just know that we have ones that work in our area for veterinary drugs, but none of them right now have claims for human coronavirus strains. Which brings me on to the next topic, which is COVID-19 in animals. And again, just want to clarify, as Dr. Roy mentioned, likely originated from bats. So this outbreak likely originated from bats. There's some speculation of an intermediate animal host, such as the pangolin, but there's no evidence that suggests that pets or other domestic species, including our livestock, have played any role in the transmission of this disease. Additionally, we haven't had any cases here in the United States of pets, wildlife, again, those domestic animal species, including our livestock, pigs, cattle, poultry, etc., that have tested positive here in the United States. With that said, there's been a number of cases of dogs that had tested weak positive in Hong Kong that were tested whose owners had a COVID-19. Neither case was symptomatic. But these animals were tested anyway with a test that looked specifically for virus RNA, right? So it was looking at to pick up pieces of that genome that we talked about that consists of the virus, or excuse me, that the virus consists of, so not necessarily looking for true disease and true infection. And as I mentioned, there's been no instances. We haven't tested any animals here in the United States, and the public health community, especially our state public health veterinarians, are working to develop protocols on when should we test these animals, when is it appropriate, and how can we interpret those results. So again, wanted to make that completely clear. Additionally, there's no evidence to suggest that this disease can be transmitted via food or food packaging, so it is not considered a foodborne disease. Out of an abundance of caution, however, the CDC does have guidelines. It's on their website here. The USDA and the FAO have comments around that foodborne comment that I just made, so it's not a foodborne disease. They have that directly listed on their webpage. And again, the CDC has recommendations out of caution to help prevent potential spread to animals if such a situation were to occur. So as it relates to disease prevention, so my last couple of slides are really just how to prevent disease. And as it relates to COVID-19, it's no different than any other respiratory disease. We want folks to wash their hands after touching contaminated surfaces. Wash your hands for at least 20 seconds with soap and water. You can additionally use hand sanitizer that's at least 60% alcohol. You want to avoid touching your face. Stay home if you're sick or if you've been to somewhere with an increased risk. Additionally, we want you to seek medical care. The CDC has this great symptom checker that I've linked to here in the slide. Definitely seek medical care if you have those common signs and symptoms related to this disease or have been identified related to this disease, including fever, cough, and shortness of breath. We do encourage you, however, to call ahead. Don't necessarily run directly into the doctor's office. We don't want you sitting and lingering in doctor's offices, maybe exposing others, or if you don't have it and someone there has it, you could potentially expose yourself. So definitely call ahead and seek additional guidance from your healthcare provider as to what the next steps are. If you do test positive, I want to drive home, we quarantine the exposed, we isolate the sick. So isolate yourself, especially if you have mild disease, you need to stay in the hospital. Separate yourself from others in the household. Other household members may consider self-quarantining for 14 days. Limit your contact with pets and other animals. And again, work with your local public health officials and public health veterinarians to understand next steps. Finally, in terms of employee safety and continuity of business, we encourage folks to make sure that they have a safety plan or COVID-19 plan in place. We at the National Pork Board created pork.org/COVID-19 that provides direction on direction and resources for our producers that are trying to learn more about this condition. Additionally, we want folks to revisit their sick leave policy and keep in mind those external factors. Sure, maybe your workforce is healthy, but then the schools close around your area, you have a stay-at-home order. What does that mean for you? So be prepared to revise and update those plans as needed. And so just to reference back to that flattening the curve that we talked about before, we really want to practice social distancing, my goodness, on the farm whenever possible. So that means spreading out the workforce, and I believe Dr. Bender will cover this in a little bit more detail, but just want to drive home, reinforce, and again, I provide that link at the end. So again, Pork Board, we have resources available on our website, mostly directing folks to the CDC or Johns Hopkins, but we do have some swine specific references there that we encourage you to check out. Also reach out to your specific commodity group, whether you're with soybeans or cattlemen's, etc. They might have some additional resources that are specific to you. Again, these are other links, they'll all be live. I did include some additional content, including a glossary that helps orient you. Again, Dr. Roy presented a nice table that compared the different viruses. These are all coronaviruses. Influenza is not a coronavirus, but really just compares those respiratory viruses, puts it into context, and then the glossary helps orient you on the different metrics they provide there, and then a comment on COVID-19 as it relates to travel. With that said,
thank you so much, Dr. Fowler. So much great information, and I just want to let folks know that these slides are going to be available to you, or are available to you through our Learning Lab handouts. I know that we've got 75 of you on board. We had over 500 people register. The system couldn't handle the volume, and so we've certainly been able to get some people out in through a different link. But I just want to emphasize that if you've missed part of the first part, this will be recorded, so you'll be able to access that. And we have lots of different handouts that you'll get after the session. So just keep that in mind. We've got a great list of panelists, and thank you, Dr. Fowler, for that. Anything else before I move on? Okay. So we have next up is Dr. Jeff Bender, and I'm going to go ahead and make him the presenter here. Okay, Dr. Bender, you are the presenter.
Alrighty. Is this in the display mode, or do I need to swap that out?
Yeah, swap it out so it's in display.
Does that look right?
Yep, you're good to go.
All right. Well, good afternoon, folks, and I hope I can add on the comments of my colleagues here. The title of my session is Keeping Producers and Ag Workers and Their Families Safe During This Time. So let's just quickly begin. What I want to do with you for the short amount of time I have with you is just to remind you about the NIOSH Ag Centers and who they are and how they're distributed throughout the United States and how they could serve as a resource for you. Thinking about the challenges for our rural communities, and then how do we prepare for this upcoming wave that we're kind of already in, and then talk a little bit about some mental health resources, and then just a quick overview of some of the questions that I've been getting. First, I'd like to just give you
for a second because you're
sure.
You can click on that red arrow, and because it's kind of covering part of your slides, that red arrow where you see the control panel for the presentation.
Okay, let's see, red arrow.
Yeah, so right up where that control panel is, that has like, oh, there you go. You can go back to your PowerPoint presentation.
Okay.
Click on that. There you go. And then do you see where there's like the dialogue where you have your controls, like your volume and your, up at the top, there's a little red arrow.
Oh, it's actually on my screen here.
There you go. Now it's gone. Yep, you're good. You're perfect.
Okay. All right. Sorry about that.
Sure.
All right. Just a quick overview of the National Institute for Occupational Safety and Health Ag Centers. They're designed to really minimize the burden of occupational disease and injury in agricultural workers and their families. And we do that through kind of some research, prevention, education, and communication. And unfortunately, we have a real-time situation where we're needing to apply those issues. Just to give you I need to go back to my screen here, bear with me. These centers are actually located throughout the United States. So I just highlight here, for those of you that are in different parts of the country, these are resource centers that you can tap into, and hopefully they can actually provide some local resources for you, because it reflects the fact that we have forestry, fishing, and farming in different parts of our country. So just want to just give a shout out to those different individual centers and the activities they're doing. Specifically, our particular center is located in the upper Midwest, and we have a number of partnerships with our schools of public health, our veterinary school, our Department of Health, and also the National Farm Medicine Center in Marshall, Wisconsin. Also, because we do work with Hispanic workers and migrant workers, we work with Migrant Clinicians Network based out of Maryland. As Dr. Fowler pointed out, we also approach these complex, wicked problems with a One Health approach. And so we really have a goal to really look at health outcomes both for people, animals, and the environment. And we do that through actually thinking about how do we communicate together, coordinate together, and collaborate together. And so when I think specifically about this issue and my concern about our rural communities, there's a number of things that really come to mind. One is that many of our folks that work in our rural environments feel safe because they already feel like they're isolated and thinking, this isn't going to come to me. Also, our rural populations are older. On average, our farmer in the States is about 58 years of age. And another issue that we're really experiencing in our rural communities is that we have limited healthcare access, or that's not readily available, or we know that many of our rural hospitals are closing. We also have this feeling of invincibility. You know, I'll be fine. And then the other thing is we don't have really redundancy in our workforce. We have a limited workforce. So if somebody gets sick, then we really do have limited folks that actually can pick up the work and take us to the carry on if we're not available to do the work. So some things about how should we prepare. And so one is that we really do want to raise the awareness. I really appreciate our organizers and sponsors for, hey, this is a big deal, and really raising the awareness and really signaling the fact that it's coming. The other thing that we need to do is we need to engage our employees, talking to them, listening to their concerns, thinking about how do we best plan for this impact. And then that is next to setting up a plan. How do we do this? And then lastly, you know, we need to lead well. We need to be good examples for our employees, for the people we work for our communities, and how we can respond to this. So one of the things that I just want to just give some general recommendations for employees is, you know, on many farms, be it livestock operations or other agricultural operations, is that we need to practice good biosecurity. And we've been talking about this for a number of decades now. But part of that is to limit farm access and also limit activities to really essential activities. We don't want people on our farms who shouldn't be on our farms. The other thing that I really want to emphasize is what Dr. Fowler mentioned is if we're sick, we need to stay home, even if we have mild symptoms. You know, as was pointed out too, that asymptomatic folks may, or folks with mild symptoms may transmit this virus. The other is just to wash our hands frequently and to use hand sanitizer if we can't wash our hands frequently. And then disinfect commonly touched objects like phones and computer keyboards or doorknobs in our work environment. So this is actually some material that actually our Swine Disease Eradication Center actually put together and sent out to folks. The other thing is that people will say, well, why don't I just wear a mask all the time? And really, one of the things I want to just remind folks is that, remember, personal protective equipment should be our last resort. We should be looking for other ways to make sure that we're not allowing that bug to come. In other words, if you're sick, please don't come to work. Is there ways that we can kind of administratively or engineeringly-wise, you know, through hand washing and work policies, prevent that, and only use personal protective equipment for those who really need it. And in this case, it really is necessary for those that are in the healthcare industry, those nurses, those doctors that are actually seeing patients who really do need to work and use those personal protective equipment. So just a quick reminder on this hierarchy of controls. The other thing just to really emphasize is the issue of social distancing. We've heard a lot about this, but what does it look like on a farm? One of the ways that we can think about this is maybe we can do early morning huddles and divide tasks and hear about potential problems by video conferencing or maintaining kind of some social distance or 6 feet apart. Can we change our work schedules to limit the number of people that are coming in or stagger when they're coming in? Is there ways that we can kind of segregate individual areas and use cell phones or video conference to really communicate if we need to communicate? Also, when we think about the break room, can we limit the number of people that might be in the break room? Maybe 2 people at a time in a break room are just some practical examples, and you may have to think of others depending upon your individual situation. The other thing I just want to take a notice is that, we're a week into this now, this large experiment, if you will, of practicing social distancing, dealing with the pandemic here in the United States. But we need to think about frankly, the stress and the anxiety that we're going through, recognizing it not only in ourselves, but also in our neighbors and our friends. So one is just to be aware of the signs and symptoms of stress, the importance of checking in on our neighbors, even if it be Facebook or other mechanisms, and really encourage regular social interaction and support, either through our local churches or virtual coffee visits. Again, thinking about the mental resiliency and mental health of our rural communities. And that brings me to another point that I just want to remind us is that we need to work and respond in a community. And so this involves kind of more of a team environment, thinking about, well, who can we engage in the process to really get us through this difficult time? Is it our educators? Is it our community leaders? Is it our extension service? How do we support our healthcare providers? Are there veterinarians that actually can serve as resources in that regard? Or are there ag educators that might be somebody in our rural community that can actually help us with that? Again, one of the basic reminders that we need to reinforce is the importance of hand hygiene and hand washing. So wash your hands, avoid touching your face, which is hard to do. Stay at home if you're sick, even if you think it's just a cold, and then practice that social distancing. And there are some resources out there on how to do that. The other item that I've been getting some questions with as well, and Dr. Fowler has brought up, is also we need to protect the animals. At this point, livestock or other animals have not been shown to transmit this virus to us, but we want to really limit the potential for transmission. Remember, as Dr. Roy pointed out, that this virus originated likely through bats, through an intermediate host, and is now well adapted to people. Again, if you're sick, stay at home, and then also avoid contact with your livestock or contact with your pets, or limit that so that we don't transmit to them as well. So just to start to finish up, these are some of the questions that I know that I've been getting a lot of. Is, what if one of my becomes ill with COVID-19? What do I do? How long can this survive on surfaces, and how can I disinfect it? And both these questions have been somewhat answered from our previous 2 speakers. What does social distancing look like in our workplace? And I gave you some examples of that, and again, it might be dependent upon your specific situation. Another question, shouldn't we all be wearing N95 masks? And the answer is no. We need to reserve those for our healthcare providers. And then lastly, what's the role of pets in transmission? Again, we haven't seen transmission from our pets to us, but we do worry that, we could give it to our pets. So if you're sick, please take some precautions to, limit your contact with your pets. So in summary, we need to just raise this awareness, especially in our rural communities. We need to really create plans to support producers, workers, and their families. And then we need to kind of be aware and prepare some precautions. And then lastly, I just want to encourage folks to engage their communities there. There is some general information on our UMass website, also even on the mental health resiliency piece, and then also for hand washing. We do have one video that we did in conjunction with the National Pork Board on how to protect animals with influenza, some of these same concepts can apply with COVID as well. We just don't want to give these diseases back to our animal populations. And with that, I'm going to turn this back to our moderators.
Hey, thank you so much. I'm going to go ahead and go and transfer to our next panelist, and that is Mike Keenan. So Mike, I'm making you the presenter.
Thank you, Natalie. Really appreciate the opportunity to be here, and I really want to thank you on behalf of Gallagher for the opportunity to sponsor this webinar today. It means a lot to us to consider part of the team here. You know, I work with agriculture all throughout the Midwest and have kind of been coast to coast as well with our clients. And the things I know about people in agriculture is they are extremely resilient and resourceful. And I really appreciate all that's going on within agriculture, how we maintain an effective food supply. As Heather mentioned earlier, we are one of the primary resources that we need to have up and running so that during this time when so many people are staying at home and inconvenienced by all of this, that we have a constant and healthy food supply. One of the questions that we are getting, of course, in the insurance industry is, what about workers' compensation insurance for those individuals who are sick? Well, so first of all, I want to always caution you or consider that if you have questions about your workers' compensation policy or any other policies, that are in constant communication with your carrier or your insurance broker. Each policy is a little bit different and specific language is covered in each one of them. But generally, compensable work comp claims are likely to come down to whether or not the disease is considered occupational or not. So in order for it to be compensable, the disease would have to be contracted during the course of their normal employment. And in addition to that, due to conditions that are very specific to the employee's work. So we can look at the example here, healthcare workers, first responders, and so on, where they have a direct contact with individuals who may be sick and may have the exposure. Those individuals would most likely be covered. Those who would have incidental contact or no different contact than they would have in the public would probably not be covered. But again, you certainly want to cover those with your carrier or your broker. One of the other questions I get has been in regards to OSHA, and some of that involves record keeping, and similarly to to the workers' compensation insurance, if it's directly related to our workplace activities. For instance, caring for individuals, if you're in a high-risk area where you're caring for patients and so on who are ill and we're having direct contact from that, most likely that would be a work-related exposure, whereas agriculture would generally be considered a lower risk because it's not part of our job duties to care for people who have the COVID-19 virus. There's a lot of guidance provided by OSHA on developing and preparing a workplace to deal with situations like this. So I would want to point out here, there's a guidance for preparing workplaces for COVID-19, great resource for any industry, but I think that it can certainly be applied to agriculture as you look at some of the features in this or steps to be taken in preparing our workplaces. So under that guidance, we could look at the fact that one of the things we want to certainly do is to develop an infectious disease preparedness and response plan. And of course, the time is now for that. We are well into this, and it's emerging and changing rapidly. And so we want to get ahead of this as much as we possibly can. It's time to prepare and implement an effective infection prevention control measures in our work sites. and to develop policies and procedures so that we can promptly identify any individuals in our teams that may be becoming sick and showing symptoms, or if they're not feeling well, certainly encouraging them to stay home, not only for their own benefit, but also for the workplace continuity. To keep our businesses up and running, we've got to keep everybody as healthy as possible. One of the things I know working in agriculture for as long as I have is that there's a lot of tough people out there who will come to work no matter how they're feeling because the job's got to be done. Well, in this case, it's really important for those individuals to stay home and leave the work to somebody else until they get to feeling better and free of symptoms, and follow the guidance of their doctors before returning to work. We need to develop and implement and communicate workplace flexibilities. A lot of the things that we're going to need to do to adapt our businesses is to provide some flexibility. It's not necessarily good to do things the way we've always done them, because we're missing some of those steps that are going to prevent that illness and virus from taking hold in our workplaces. And then we can implement workplace controls. And along the way, we need to make sure we're following other safety standards so that we can always keep our employees safe and healthy. So I think the most effective way to do this right off the bat is to develop a task force. And certainly we need the leadership of our employers right up front on this. They need to take the leading role, and then to encourage all their frontline employees to become engaged as they help to understand what the risk exposures are within our operations. And so we've got to really engage everyone in this, understand the exposures, where there's potential for exposures that we may not be looking at on the surface. So digging right into that. And then the next step is to complete a risk assessment. And you know, the CDC and the EPA have some fabulous guidance out there. The CDC, and we've heard from the other presenters about those resources. They're there, but we need to be able to adapt those recommendations to our individual workplaces. Our conditions are different than an office setting, and so we've got to be able to, you know, telling people to stay home and work from a desk, that's not really going to work here. It may for a few people, but we've got a lot of other people who we depend on to be there each and every day, whether it's milking cows or helping mama pigs deliver, or mama sows deliver piglets and those kinds of things. So we hear a lot about social distancing. And I think I've heard over the last few days, maybe thinking about rephrasing that into physical distancing, because we don't want to separate ourselves socially from our coworkers and our neighbors and our family, but we need to develop that physical distancing so that we're not sharing that exposure to disease. So we got to look at those processes that bring staff into close proximity and figure out, okay, how do we prepare them and set up workplaces so that we can spread that distancing out between employees. Looking at the shared tools and equipment that our employees use on a regular basis. I think about like a tractor repair shop where we've got mechanics in there keeping our equipment up and running at all times, and they're sharing tools and equipment on a regular basis. And so how do we manage that? And we've talked a lot about personal protective equipment, and I know Charlotte's got some more information to share with us on that, but we need to make sure that it's not just N95 dust mask, it's the boots and gloves and face shields and all those other things that we use that sometimes get used pretty commonly and shared with different employees. And what about shared vehicles and equipment? You know, there's a pickup or a tractor or truck that gets shared with a number of different people throughout the day. And of course, then those common spaces like locker rooms, offices, break rooms, and kitchens, and so on. Once we've done that risk assessment, then we need to adapt some best practices to mitigate the risk. So based on that risk assessment and using a hierarchy of control, then we can start to manage those exposures. We need to consider eliminating exposures where we can. And a lot of that can be based on providing that separation of some distance between employees. Maybe we need to stagger shifts, stagger meal times and breaks, all those kinds of things. I always enjoy going to lunch with, for instance, in a hog farm or dairy where we've got a lot of people coming together at a noon break, and they're all kind of sharing lunch together. And that's a great culture, but now is not the time for that. And so we need to figure out how we manage that and break that down so that we don't have that constant exposure. And again, along those same lines where people are sharing meals and preparing food and things like that, that we're using really good sanitation, really stepping that up. And then, of course, we've talked about the personal protective equipment. One of the things that I see in some of the farms I go to is, you know, we have a boot room full of boots in a hog farm, and you just put on the size that fits you. Maybe it's time for every employee to have their own and keep them sanitized every single day. And the same with gloves and things like that, so we're not having cross-contamination between our employees. And finally, then working at implementing workplace controls. I think this is a critical piece now that we've got the information. Engineering controls are really not appropriate here. Those would be more for like a hospital setting, but we can start to look at those administrative controls. And we've already touched on those, the staggered shifts, communal meals, and physical distancing between employees. And then looking at those safe work practices, disinfecting the tools and equipment, frequent hand washing. One of the things that I can tell you is in many of our operations, the hand washing facilities are a fair distance from each other, and there's not that many. So maybe we need to step that up and increase those opportunities. If we don't have soap and water, that we have the hand sanitizer and those kind of things. Maybe we put hand sanitizer in all the vehicles so people have them with them all the time. And then really increasing and maintaining then the sanitation of our work facilities, our break facilities, showers, locker rooms, and that kind of thing. And again, that PPE, knowing when to use it and why to use it, and preserving especially the respirators and N95 masks. And finally, then we've really got to step up the training on our staff. We need to continually communicate to them and really emphasize the why of what we're doing. That number one, certainly it's to keep them and their families healthy. And to number two, to help them understand that they are truly crucial for the success of our methods and procedures in keeping a safe and healthy workforce and maintaining operations, and then monitoring and managing where we've come from and where we're heading to. We want to make sure that we're over communicating that information back to our employees, back to our staff members, making sure that everybody understands as things change, keeping them updated on progress that's made or critical areas that need more attention. So to wrap up, I want to thank you again for the opportunity to be here today. Again, on behalf of Gallagher, I want to thank you for the opportunity to support this important work, this information, to get it out to our ag producers throughout the country. Keep in mind, if you have any questions about your insurance, to make sure you're reaching out to your agent or to your carrier so that you can have the proper guidance on that. And with that, thank you, Natalie. I really appreciate it, and I'll turn it over to the next speaker.
Thanks so much, Mike. And the private-public partnership here is so important. You can see why you need to contact those companies that you're working closely with. They have great resources. I want to go ahead and transition to our final presenter, and that is Charlotte Halverson. She is a clinical director of the AgriSafe Network, and we'll share some insights. So Charlotte, let me go ahead and make you a presenter here. One other thing while Charlotte's getting her presentation up, if you have questions, feel free to put them in that question box there. We're happy to take those. And Charlotte, we can see your slide.
All right. Is volume okay?
You can lower it just a little bit.
Lower it? Okay. How's that?
Good, perfect.
Okay. Well, I'm going to wrap this up with a couple of points, and one of them will be on the personal protective equipment piece that some of our previous speakers have talked about. But I also want to make note that as is working for AgriSafe and as a clinician, this has been really valuable. I'm really grateful to our panelists, because this information on epidemiology and evidence-based resource is so important, because as providers, healthcare providers in the community, like so many of you in other fields that are on this today, you're all in key positions to help not only kind of stem the panic so much that's going on, and that's important, but at the same time, really realize the importance of emphasizing and re-emphasizing the urgency of the preventive measures that we've been hearing about. And also, so many of our healthcare providers and are also producers, so they are sometimes wearing more than one hat. So we're really grateful for all the information that we're gleaning out of this, and we're glad that this is being recorded for future use. So a bit on personal protective equipment and what we've all been hearing and talking about, and of course the buzzword is N95. And what is that? And as a mask, and what does that mean? Well, N95 is the minimal protection that we recommend to our producers for protection against dust, mold, and those kinds of things that they come up against in the agricultural community. And we've had a lot of questions from our producers about, well, with this COVID-19 stuff going on, how am I going to get a hold of what I need for my work environment? Right now, this N95 is a current minimal protection recommended for healthcare workers, and we recognize that the supply is very, very low, and it's a major concern. And it really behooves all of us. We need to know that right now these healthcare workers that are on the front lines are going to be the ones that we want to make sure have the protection they need. To our producers, if you are looking for protective equipment, there are a lot of websites and online resources that you can look to shop if you want. Keep in mind that the availability is becoming slim. So if you're looking for protective equipment, I would advise you to do that now. And there are some great web resources out there. It might also be an opportunity to think beyond N95 as far as dust and mold protection goes. And there are other options out there, and you can see some pictures here of things that we recommend. This might be a great opportunity to upgrade to a half-face respirator with the cartridges, and we found that a lot of our producers really like these once they get used to wearing them, and they feel that they get, actually a lot of them will say it's much easier to breathe with all of these on. So that's one of the things that we talk about. The other thing that we have a concern about is the push towards saying, well, is it okay if I just wear a handkerchief or a cloth mask or some of these things? And it's important to remember, as the CDC will tell you, that these are not considered to be personal protective equipment. What they are in the looser fitting surgical masks, what they will do is give protection to some people against very large droplets like a wet cough or something like that. They have no protection whatsoever against a virus. Even the N95 filtering face pieces are not guaranteed to block out viruses, but they do fit tight, and they are a much better source, as we said, for our healthcare providers. So these are some of the things that we're saying for our farmers. Take a look at some of the options that are here. There are a few points to remember, just as we're telling people when you're putting on any kind of a respirator, there's some things that we want to make sure that you don't forget about. Number one is that it has a good seal on it, and that seal has to be, as you see in the first diagram over here, lengthwise and also widthwise around the mouth. One of the things that we also encourage, and it's a great resource, I think, from the CDC, is this thing on facial hairstyles. And I didn't know there were so many facial hairstyles out there. But these are the areas that you need to be sure that if you have facial hair, that you are either changing your hairstyle on your face or making sure you have respiratory protection that completely goes around it. The link on the bottom is one from 3M that answers an awful lot of the questions that our producers have about respiratory protection. And several of our manufacturers also have similar resources available. So if you have questions, this would be a great resource to go to. All of the manufacturers are really coming on board and getting their information out there about not only just COVID-19, but other types of protection that would be needed. But it is difficult right now to say that the stuff is available. It is important that if you're shopping to do so now, and please, if you have questions about it, you can certainly contact us through AgriSafe, and we'll be happy to guide you through. I know that Dr. Bender and the UMass Center, the Ag Center, is working hard on developing a new resource that kind of addresses some of these issues. And I think it's very close to being ready to go. They've got a couple of final reviews to do on it, but we applaud them for their work in putting things together for our people and our agricultural communities to have available. A lot of folks have asked us, well, we see all this stuff out there that the people in the hospitals and that are wearing, shouldn't we be wearing the same thing? And the answer is most often, no. This is not recommended, and it is not needed for people that are healthy in the general public. What you're seeing pictured here are the isolation gowns, the types of gloves and goggles and face shields that are being recommended for our healthcare providers. But these are not the things that those of us in the general public would necessarily need to be concerned with, because again, this is a virus. It's a very small virus. Even our N95 respirators are recommended for exposures down to 0.3 microns, 0.3. And a lot of these viruses, as you saw, Dr. Roy earlier had a slide, the COVID-19 in particular is largely 0.1. So if you think about one strand of hair is 70 microns, and these viruses are this small, it's there's really very little protection that would really be effective. And so the protective gear that is the best is the distancing, the hand washing, stay home if you can, and for sure stay home if you're sick. So these are the things that we are really, really trying to impress on folks. And as it is, it takes a village, so we all need to be doing that. Just take care with the basics, the physical distancing, again, covering your mouth when you cough, in your arm sleeve, turn away, wiping surfaces down with disinfectant frequently. And NIH had some really good information out on that. We have a link that'll be available in your resources. What kind of talks about the different lengths of time that different surfaces can hold these viruses. So, and the other thing that we'd like to really impress upon people is the importance of, as we go through this together, the importance of nutrition, the importance of hydration, and getting restorative sleep and rest. Because if we don't do those things, we will even increase the importance of not getting sick. We just do not want to be putting ourselves where we're so run down that we pick up anything, let alone the COVID-19. There are other resources out there from the CDC that talk a lot about these these respirator issues, the personal protective issues, and they're great resources. So we really do want you to get out there and look at them and use them in your communities, in your offices, and in your practices. We know that the young adults are impacted by COVID-19, although we realize that it's the older population that it has the most serious impact for the most part. But the CDC, Center for Disease Control and Prevention, just recently did a little look at this, and it showed that 38% of those sick enough to be hospitalized were under 55, and about 12% of the COVID-19 cases in the United States that were known to need hospitalizations were age 20 to 44. So this graph kind of shows that in the different age groups, and obviously the 65 and older is still the highest, but there's a significant number of the younger folks, and the fear is there's that infallibility factor going on that, well, I'm not going to get sick, or I won't be very sick, but the thing we want to impress on them so much is the importance of not being a carrier and breaking that chain of connection. I really appreciate Dr. Bender's emphasis on the mental health piece of it, and we're going to spend just another couple of minutes talking about the stress that happens when we're looking at these issues. And as we face this crisis as a community, we know that there's a really heavy stress on our producers and their families and our local businesses in particular. Because each of our communities is unique. There just isn't any cookie cutter response or outline or algorithm that we can use as a response tool. So we really do need to reach out and address the isolationism, the impact of travel restrictions, because that impacts their ability to acquire food, get your medications, healthcare services, and such. And it doesn't help that our usual socialization points are not accessible right now. Our coffee shops, our churches, our senior centers, and we can go on about it. So this is putting an additional stress on to what's already going out there. We know that production agriculture is experiencing high stress levels already for a number of things. We know that some of these stress levels are weather related. If you live in areas like I do here in Eastern Iowa, we're preparing for flooding again. And we know the stories from last year in Western Iowa, Nebraska, and other states with the damage from floods. And we know that fires in some of our rural communities, particularly in Wyoming, Montana, Northern California, some of those areas, the impact that had. We know that there's stresses related to the unseasonable heat or cold throughout the year, and this always can impact our crop production, our animals, and our own health. Everyone is worried about commodity prices and the trades and tariffs. We worry about land values. We worry about property and crop insurance, and Mike Keenan did a great job of talking about how this is impacting things right now with the COVID-19. Everybody's always worried about healthcare costs, and I think one of the things that in the last week or so I've been hearing from a lot of people is, oh my, I really don't know what I would do. Succession planning, I keep talking about doing it, but now that we've got this emergency going on, and if I get really sick, what's going to happen, and how are we going to pass things down and do it the right way and do it effectively? So emergency management planning and succession planning all of a sudden are becoming really, really key issues for folks. And the family dynamics. We know that there's a lot of stress in a lot of families about who's responsible for what and how to share responsibilities, and is somebody having to work off the farm or not. Those kinds of things are just always in conversation, but never more so, I think, except for the last couple of weeks. We do know on ranches and in farms across the country that our farmers are working long days. We know that they are usually not getting that sleep that they need or the rest that they need, and that the stress that they're experiencing exacerbates all of that. We know that we have a lot of at-risk populations. Our elderly are obviously one of them, because our farmers overall are, I think the average age is about 58 years old across the country. So we know how many farmers are over the age of 60. But we do have an at-risk population in our young people. We have teenagers working on farms, and we have kids with a lot of these exposures. And this is a stressful thing for people, and trying to figure out how to manage all of that. And the frequency of working alone. A lot of our people in agriculture spend a lot of hours isolated and working by themselves. So isolationism is becoming a big concern. And I think with the COVID-19 stressors, it's going to become even more so. This last week or so, a couple of weeks, the COVID-19 has really ramped up the stress when it comes to the impact on market, the impact on supply chain, being able to access service providers and animal care. Who's going to be able to come on my farm and take care of my animals? And how is that interaction going to look? Am I going to be able to pay my employees? Am I going to be able to get employees on my farm to take care of the crops? So these are really big issues that this COVID-19 is going to be in the mix for a long time. So it's not going to go away in a week or 2 or 3 or 4. How am I going to get ready to be able to do my spring planting? How am I overall going to care for my family and all the financial obligations that go with that? And the increased stress on family dynamics again. It just makes things that are maybe an issue just even a bigger issue. I will say about family dynamics, sometimes it can be a good thing. I just had a conversation with somebody that said, you know, I went for an hour-long walk with my teenage son, and that would not have happened had we not been kind of forced to not be out and about and not in school and not at work. So maybe there is a little silver lining once in a great while. One of the things that we were concerned about isolationism and the social distancing, and as Mike said earlier, this I like to refer to it also as physical distancing, because socialization is important, and we need to be creative as to how are we going to make that happen. When we can't be in that physical presence that we're used to, because isolationism just really creates an increased loss of that social network that we're used to. It really impacts our older adults that aren't able to be out and about, or maybe they're in a nursing home or a senior citizen center, and all of a sudden have absolutely no visitors for a long period of time, and not even their family. It really messes with everybody's ability to establish a routine, whether that's in their family life. How do I get schoolwork done? How do I keep that ball rolling at home? It messes with work schedules. I know here in this house right now, we're trying to 4 different people do home office work. So getting those things organized is tough, and we recognize that. And we know that that there are resources out there too, if you want to share them with your workers and the people that you hang out with, now virtually, obviously, and make sure that we are sharing resources as much as we can. And that's part of what this today is all about, is looking at the resources, sharing the resources, and knowing where some of our contacts can be. And that's why I'm so grateful to everybody today on this panel. The impact on our brain health, on our mental health, all this COVID-19 business is doing is creating even more stress. And we can talk about all the good things that we can do and how to work with it, how to minimize it, but we also need to really be aware that when we're talking about our major agricultural livelihood, that those changes in families and coworkers and neighbors are, it's really important that we be aware of what's going on. And it's really important that we understand that we just can't very easily look for alternatives sometimes, because they've got so much on their mind and so much going on that to really think clearly and to say, oh, well, geez, you know, a game of cards is going to take care of things, or baking brownies, it's not going to do it. That's for sure. So we really need to be working together. Just real briefly, some of these signs and symptoms that we need to be looking for in our coworkers, in our family, in our neighbors would include some of these that you see listed here. The depressed moods. Sometimes people are crying frequently when they normally wouldn't be. Maybe using poor judgment, extreme guilt, kind of flying off the handle, becoming angry without usual, you know, any provocation that we can see. And physically, the inability to sleep, or else sleeping all the time. It just seems that pendulum goes both ways. Sometimes there's a significant change in weight. People can be eating all the time or hardly eating at all. You'll hear people increasingly complain of headaches, musculoskeletal pains, GI disturbances, and unfortunately, in these times, people will turn to overuse of tobacco, alcohol, and other drugs. And we know that we've been doing a lot of work recently with opioid overuse, and that's they all tie together. They all tie together. It is necessary, I think, to remind folks of the warning signs and symptoms of suicide, because we know when times get tough that this increases. And we all know, and we've seen all the statistics, that the percentages in rural America far outweigh what happens in urban society. And probably, you know, the access to things like chemicals and guns have a lot to do with that. But some of the things that you may want to be looking for in folks around you might be an increase of substance abuse, maybe the stopping taking medications or hoarding them, seeming excessively depressed. Sometimes people have a preoccupation with death and dying. They become extremely irritable. They may even admit to thoughts of suicide. If you ask somebody, have you ever thought about just putting an end to everything? And they say yes. This is an important thing to pay attention to, and to be with them and to talk and try to get help immediately. If you think someone is in crisis, call 911 immediately. If you can be with them, don't leave them alone. We know that these positive coping mechanisms we talked about, when stress is so intense, they just don't work. But sometimes it does. Sometimes we want to look at the possibility of injecting a little humor, like Dr. Fowler and her cats. I thought that was just very cute, a very nice way of looking at things. Physical recreation and exercise. Just get outside and go for a walk, even if it's for a few minutes, sometimes makes a huge difference. We all are going to have to adjust our expectations. The things that we normally expect to do are just going to have to really be altered. And not being afraid to talk about things, to have a conversation with someone, may have to be over the phone, but to do so. So some of these positive coping strategies need to really become a part of our vocabulary as we work through this COVID-19. For your information in your area, I know everybody's region is different. As we said, there's no cookie cutter for everything, but if you have concerns or if you just want information, general information, call 211 or you can text it. And I did try this not yesterday and it worked just fine. I got a response right away. There's a help at 211info.org or if there's an emergency, obviously call 911. And again, back to the mental health piece of it. And if you have someone's at risk for taking their own life, call 911 and really try to be a partner with them because they need your help. These are some of the resources that I know that Stacy has online with this webinar that you can download, and these are just a few of the many that she has out there. And with that, I am going to turn this all back to Natalie, and thank you, all of you, to our presenters for their time, and for those of you that are attending this webinar. We are grateful for your help in our work. Thank you very much.
Thank you, Charlotte. And it's so important that you spent time talking about the mental health impact. I'm going to go ahead and share my screen just so that you all can see where you can find the handouts that we've been referencing here. A lot of these resources are in PDF format, and you can see it on the screen. So the system that was not functioning, that crashed right when we were about to start, is this LMS system that you see. And you'll notice that if you go ahead and log in, you will find all the handouts that have been referenced. And so these are easy to access. One of the first ones listed here is the one from SAMHSA dealing with anxiety about infectious diseases. I think that's so important that that's shared. And then this will also be the place where you will find the recording if you missed the beginning part, or you have folks that are looking to access it. So please check back there. I want to go ahead, and we do have a few questions, so attend to that. But in the meantime, I also want to mention to you that AgriSafe's position is to really identify the experts who can speak on subjects. And we certainly know that there's a lot more to cover regarding COVID-19 and the impact for farmers and ranchers. For example, we know there's an issue with labor shortage that can have an indirect impact on health and safety. And so if you are in a position where you feel like you have valuable information that can affect the health and safety of the farmer and the rancher, please reach out to us. We want to know about your work, and we know that we're in it for the long haul here. We know that it's going to be important that we identify specific topic areas beyond what's been covered today. So we're starting with some questions here. I'm going to start with the first one. And for the panelists, feel free to unmute your mic. I'm going to go ahead and make sure you're all unmuted, and just make sure that you go ahead and mute your mic if you're not answering the questions. But the first question is, what are some suggestions if some staff members are not taking physical distancing serious? For example, break time not being far enough away from one another.
This is Mike Keenan, and I think, again, part of that gets back to the communication and leadership. Leadership has to take a really strong stance and, you know, really enforce the requirements that they put in place. You know, if there's an issue, I think employees need to understand that they can go to management, and that management will be impactful and enforceful in that separation occurs. I know, having been out and about going to the grocery store and things like that, there's some people who obviously believe that maybe it doesn't matter to them, or that they're not at risk, and so why worry about anybody else? So there is some of that mentality out there, and I think it's really important, again, for the leadership of the the employer's leadership, to take a very strong direct stance in that.
Thank you, Mike. I'm going to go ahead and move on to another question as well. So we have a question is, if a state mandates statewide home quarantine, how does that impact agriculture?
So this is Heather. So far, the stay-at-home orders include non-essential business. And so my understanding, and the CISA, again, has specific recommendations on who's involved in that critical infrastructure, but they would definitely be involved. And so that's a federal definition when we talk about that critical infrastructure. But that's a great question of, you know, this is uncharted territory, so it's somewhat unpredictable. So if restrictions get even more severe or extreme, what does that mean? And the truth is, we don't know. For right now, we are focusing on that critical infrastructure and making sure it's up and running. Mike, did you want to expand on that?
Mike, it looks like you're self-muted, so do you have anything else to add about the issue of the statewide quarantine that impacts ag?
No, we haven't received any other guidance other than what Heather had put up earlier.
Another question has to do with the use of those home sewn masks. So the question is, with the grassroots movement to sew face masks from 100% tight woven cotton or flannel for our healthcare workers, is it really useless?
Hi, this is Charlotte, and hopefully I can address that. We really can't take a stance on that from the standpoint that the homemade masks, whether they're paper or cloth, are not made so they, number one, they're not made so they can seal. So you can't get a good tight fit with them. Secondly, they're not the type of material that is made to work against a virus. These, as Dr. Roy had on his slides before, these are very, very tiny viruses. There really is no way that a homemade mask is going to protect against the viruses. If this is what someone is choosing to wear, they're probably using them as a for something else, and I guess what that would do then is free up the N95s and the ones that our healthcare workers need, that are the frontline workers, to have them available a little more readily. But there's just no way that we can say that those masks are going to give you any protection when it comes to trying to battle a virus. And does that answer the question?
Yes, Charlotte, thank you for that. And we do have, I just pulled out the handouts again. We do have several documents here that talk about respirators and cleaning of respirators and such. We have another document that has to do with reference to a journal article of studying this. So we'll put that up there.
The CDC is very clear on and they lay that out pretty nicely. So if you go to the CDC websites, they will have information that will address that also.
Yes, and also we had a participant just mentioned as a good recommendation. The CDC does say that it is last resort and to use with a full face mask. So, so that's another reference point for that. I want to go on to another question here. What is a recommendation for carpooling policies within our agricultural workers?
This is Mike, and I think, as we look at that social distancing, I think, it would be best to curtail that practice if at all possible. Certainly I understand the reasoning for that. I've been to some farms where carpooling or even, company provided transportation is used to get workers out to the farms. But again, that's pretty difficult to keep that 6 foot of separation when we do that. So, maybe at least look at ways where we can maybe make multiple trips if we need to decrease the number of riders in a vehicle.
Yeah, I would second that. We would want to limit carpooling for that reason.
I have up on the screen here so you all can see one of the handouts that we have references guidance on preparing workplaces for COVID-19. And this would fall, I think, well into the next question, which is, how do you talk to your manager that you don't feel comfortable being at work right now?
So this is Heather. I'll take a first stab at that. I think it's important, as we mentioned before with some of the earlier questions of maybe folks not taking physical distancing or social distancing seriously. It really needs to come to leadership, and leadership needs to make sure it's clear to their employees that they are trying to protect them as it relates to animal agriculture. We are a critical infrastructure, and it's important to continue to make sure we fill that important need at that time. So I think it's as important to share and say, you know, I don't feel comfortable, I'm worried. What are we doing to protect me at work, and ultimately my family, etc., and have that conversation. And it's an opportunity for our leaders as well, to show that they are prioritizing the health and safety. I'm sure folks have received numerous emails from different groups, whether it's restaurants and hotels and other places, saying these are the things that we're doing to protect you and to protect our workers. So making sure from a leadership perspective that we're having those conversations with our employees, because I suspect those questions would arise because those conversations haven't happened. And thankfully, as I mentioned, CDC has guidelines for employers to share with their employees. So for those managers on the line, business owners, etc., I highly encourage you to go seek that out. The Pork Board also has those resources to help you have that conversation, because your goal is really to protect those workers as we, again, fill that critical need.
Thank you, Heather. And just to add to that issue about having that conversation with your employer or your manager, if you're in the position where you're the worker and you don't own the business, your manager or employer may not know of your exposures at home. They may not know that you have a 95-year-old grandmother that's at home and you're the primary caretaker. So it really is important to make sure that you bring the risk information to the manager, and they hopefully will work with you. And certainly between OSHA and CDC, there's guidance there for you if you run into trouble. I do see there was a question about auction houses. I think that's a unique question I'd like to bring to the panelists. So the question is, are farm auction houses affected? Are the bidders limited to a certain number of bidders from out of state allowed to participate?
This is Heather. I can take a first stab at that. I have not, I will just basically admit what I don't know in this case, in that I've not received that question before. So I might need to do a little bit of digging as it relates to animal agriculture as a critical infrastructure, whether that piece is built in and there's an understanding of those practices. So I don't know. I would say, if anything, if it is permitted under this clause of critical infrastructure, that it's important to follow the rules around social distancing and mass gatherings, again, with the understanding of trying to prevent disease transmission. But great question.
And certainly, as we find out more information, we can, since we have folks' information email, we can send you follow up. Keep in mind that every state Department of Agriculture really is trying to figure these questions out as well. So make sure it gets to your state level departments of ag, so they can help navigate the things that are concerning you that are going to be different on a state by state basis. There is a question here related to safest packaging of materials for fruits and vegetables, and I think that it's important to, there's some great references, and AgriSafe has cited some from Purdue University that, you know, your fruits and vegetables are safe to eat, and not to be fearful of that because of COVID-19. And so I don't know if anybody on the panelists wants to respond to the question about what is the safest packaging material for packing fruits and vegetables that farmers should use this year.
I think that's this is Cheryl. I think it's a great question. And I think it's like several questions that are going to be coming down the pike, are things that we're all going to have to be learning about. And I think we can all keep our eyes and ears open, and anytime we get any information from some of these resources, is to share them. And I know that Natalie and AgriSafe and Stacy will be happy to do our part in getting information shared. But the packaging question is a great one, and I'll have to be on the lookout for that one.
I think that this question about packaging too gets at the issue of people, consumers are aware of the fact that packaging, because of the virus being on cardboard and such. And so I think that the process of washing your fruit with, you know, normally washing your fruit before you eat, that's all practices that are good practices regardless of COVID-19. I don't think we have a product out there that's going to be able to fight, you know, COVID-19 on the fruit itself. And one of the questions, for example, is people are asking about their vegetables, such as, you know, one person asked, if people cough on the veggies at the store, are they still safe as long as I use Veggie Wash? And I know Veggie Wash is a product that's out there. Our organization is not, we don't focus on the food safety side, so we don't, in terms of internally with AgriSafe, but we also feel very confident in the folks that are handling food safety issues, and so feel confident about, you know, not. I noticed in the grocery store there a lot of people are buying their canned goods but not buying that fresh produce, and this might be a reason why they're afraid of what may be on that. I don't know if anybody on the panelists wants to comment on this, but washing your fruits and vegetables as you normally would is good practice for reduction of bacteria and viruses. And we certainly, since we don't have any panelists respond to that particular question, if we come across any guidance, indication, anything different in terms of your normal washing of vegetables and such, and produce, we'll certainly let you know, but that should be the standard, of course. Let's see here. We're going to kind of wrap up some of these questions, but feel free to reach out to AgriSafe after. Suggestion workers review the program we are being shared. I'm not sure what the question is, but certainly this presentation, you are welcome to share this with your coworkers, and you will be able to have this on demand. And I'm trying to see if there's any other unique questions coming through here. Okay. There was a comment that we should be careful about reusable cloth bags at farmers markets. Customers should wash immediately after returning home. So the practices for good produce washing is the same as it was before COVID-19, and certainly we stand by that. I don't see any other questions coming in. I know that we've had a lot of diverse information covered in this presentation. I want to see if the presenters have anything else they'd like to add before we close the session.
Just wanted to, sorry, I was trying to pull up a reference when we were answering that previous question. So I encourage folks to go to usda.gov/coronavirus if they're, again, interested in the food and food packaging section. So on that main landing page, under the food safety tab, they have some comments around food and food packaging. So for instance, there's no reports right now of COVID-19 being transmitted through a foodborne route through food or food packaging, but they do again encourage good hygiene practices, as you mentioned, when handling food and food products. So just to give folks that reference and push back. So I apologize, it took me a second to bring that link up.
Thank you, Heather, and we can certainly add that to our learning lab in terms of resources. Anything else from our presenters, Mike and Charlotte? I know a couple of our presenters had to jump off the line, but Charlotte and Mike, do you have anything to add?
This is Mike. I just wanted to thank you again, thank AgriSafe and all the presenters here. This is great information. I certainly learned a lot from the other presenters, and I'm sure that our listeners did as well. And thank you again for the opportunity to sponsor this presentation on behalf of Gallagher. Thank you.
Thank you, Mike.
And this is Heather. I will say one last parting thing is I think it became clear that this is a rapidly evolving situation, and we at the pork board are making sure that we're providing real-time updates on our website. So as new information becomes available to our swine producers, and all of the different commodity groups are staying engaged and monitoring this issue and providing references and resources to folks. So it's important to stay in touch with those associations, different groups. AgriSafe, as they mentioned, doing this webinar. Thank you guys so much for hosting and bringing this all together and posting that information online. And again, just continue to stay informed. You'll find, I think this week, a number of stay-at-home orders are coming through. I'm hearing Indiana was just added to that list with their stay-at-home order going into place on Tuesday or Wednesday. So you'll continue to see some disruptions. Make sure you understand what it means. We've been making sure we, again, keep our producers up to date so they understand what it means to them from a educational and outreach standpoint. So This is uncharted territory. Hopefully today clarified a lot of your questions. You might have additional questions or new questions as time goes by. So just stay in touch with, you know, trusted source of trusted resources such as the Centers for Disease Control and Prevention, and again from our swine producers, pork.org/COVID-19.
Thank you, Heather. And Charlotte, anything last words?
Just to reiterate what our other presenters have said is that this is, as Heather said, uncharted territory. We all need to work together. It does indeed take a village to tackle this. When it comes to things like personal protective equipment, as a community or as an individual, you may want to talk with your membership groups, your producer organizations, and see if you can work with a local supplier to get what you need. Would be my only other little tidbit in that area, but on behalf of the clinicians that work in rural communities, I'm grateful to our presenters for their information, because we need all of this. The better armed we are, the better we can protect.
Thank you. And with that, I'm going to go ahead and end the session, and feel free to reach out to AgriSafe if we can be of further assistance to your training needs. Everybody have a great, safe day. Bye-bye.